So the patient and carer tool, hopefully you will all be fairly familiar with what this is now. The patient and carer tool has been live since last year, but the difference this year is that the data will be available at a hospital level. So currently the data is available at regional and country level, and from August, members of the public will be able to look at data at hospital level. This is a screenshot. I appreciate this doesn't look great on a small screen, but if you want a demonstration of what this currently looks like in development, we did share a demonstration of this on our last drop-in session, so you can have a look at that on the link that will be provided in the chat box and also on our website. But you can see here that we're still focusing on 5 metrics along the top there. They are unchanged from last year. The difference, as I say, this time is that people will be able to see what your hospital's result looks like for those 5 metrics. And they will also be able to see where your hospital benchmarks regionally and nationally. So an email went out to all hospitals in England and Jersey on the 1st of June, and then to Wales yesterday, and that's because we were waiting for translation. The email went to CEOs and directors, NACEL project leads and deputy project leads, and we asked that the email was circulated to communications teams, medical examiners, quality and governance leads, patient experience leads, ICB, palliative care, end-of-life care leads, and if in Wales, health board, quality and improvement teams. So what we're recommending that you do at the moment is to familiarise yourself with your data via the data and improvement tool. Read through the frequently asked questions document. So this is a document that is live and is being updated as we're getting more questions coming in. But that document really shares information and resources about how to find your data, what to do, how to communicate with staff and support information, managing patient and carer feedback. We also have another drop-in session in July that you are very welcome to sign up to. And in that, we will do another demonstration of the tool. And we will also just be there to help problem solve any issues and answer any questions that you may have. But as I mentioned, you can watch a recorded drop-in session from June that has a demo of what the phase 2 currently looks like of the tool. It's not the final version, it's still in development, but it will give you a good idea of where we're currently at with it. And then finally, please just familiarise yourself with the process that was undertaken to scope and develop the patient and carer tool. That involved meeting and engaging with 22 colleagues and clinicians across England, Wales, Jersey, and at various different levels across the system, as well as working with members of the public with lived experience. But if you do have any questions, please don't hesitate to contact us. Hopefully we can answer any questions today, as well as in the drop-in session. So I'm now really delighted to introduce Gavin, who is a member of the public who has been working with us since 2023 on the design of NACEL, as well as more recently, the patient and carer tool. So Gavin, hi, nice to see you.
Hi.
Hi.
Excuse me. Is the fan interfering with the audio?
No, not at all. Thank you, Gavin. Not for me.
Okay.
So thank you so much for joining us, Gavin. And as I said, you've worked with us since 2023. So you are really quite familiar with NACEL now. So it's really great to have you here and hear some of your experiences about what you've gone through and also your experience around NACEL. But to start with, it would be great if you could just tell the audience a little bit about yourself and also the experience that you have had of losing loved ones in hospitals.
Yeah, so like Jess said, my name's Gavin. I live in North Wales, and I've had a lot of experience with losing people in hospitals under a number of different circumstances. when I was around 11 or 12, my cousin passed away after being in a coma. She had fallen off a ladder and broken her leg, which then caused sepsis, and that's why she passed. And over the years, and as I've been an adult and things, I've supported other family members who've passed due to cancer. There's people quite close to me who've passed away because of COVID, and I supported my mum's uncle at the end of his life when he was dying of heart failure, and I was providing a lot of support to them in different ways. My mum's auntie had me driving all over the northwest looking for the perfect Cornish ice cream because that was one of her wishes. And her uncle, again, he had me traveling all over butcher shops looking for something called head cheese, which is made from cow's brains. And as a vegan, that was quite a strange experience. But it's something that obviously is part of most people's lives. It's just that I've been in a role where I've supported a lot of people, at that time.
Thank you, Gavin. Given the experience of losing loved ones, what's your reflection in terms of what hospital teams and clinicians could do fairly quickly that would improve experience for those who are dying and their loved ones?
There's a lot of differences between families. There are some people who would want to pass peacefully on their own, even if they have a large families. There are families that are not considered traditional, and speaking to a lot of the people over developing, the tool and things, there were people from the LGBTQ community who felt that they weren't being treated fairly. And from my experience, because a lot of people in my family have autism, there are people with additional needs who feel that they weren't supported with enough support to understand what was going on, because obviously losing a loved one is scary at times, but when you are neurodivergent, for example, it can be even more so because you just don't understand a lot of it. So I think that over the years things are getting better, but obviously there's always room to improve, and that's why it was important to be involved in this project from that perspective.
We heard a lot, didn't we, Gavin, when we were working with other people in the various focus groups that we've done about people's different experiences, but that was a really common theme about kind of individualized care and how important it is to really take the time to hear what is important to patients and their families.
Definitely. I had felt over the years that there was, because of living in North Wales, there was a heavy reliance on traditional Welsh religious paths and support from the chapel. And I'm not a Christian, but members of my family are, so they felt more support and comfort from that. But again, we spoke to a broad spectrum of people throughout the process, and due to different faiths having different rules about the after somebody has passed the pathway to them moving on, there's certain time constraints and things like that. So it has to be, as you said, an individual approach, because no two patients are going to be exactly the same, even if they pass from the same illness or condition or whatever.
And this might be a bit of a tricky question to ask and answer, but given that we know that clinical teams are so busy and so stretched, what do you think is something that might be fairly quick to do that could change something so big like that experience for people who are dying?
When we were discussing the tool, there were lots of mini discussions within the groups about signposting to other organisations, because in a clinical setting everyone does have lots of things going on and things like that, but it's important that people know that there are organisations outside of the NHS that provide additional support, and there's quite a number of those that are linked in with the tool. that people will then be able to say, okay, where do I get this? And then they can just click on the links in there and find quite a wide variety of different support organisations who can help to guide them and answer some of those questions.
Thank you. You were a tremendous help along with your peers in creating and developing the patient and the carer tool. Hope that will change or improve when it's published in August?
I think it's got the potential to help people in a lot of different ways. Obviously, it's going to take time for these things to become common practice because it's a very new thing. But I'm certainly hopeful that with all of the input that has come from a lot of different people, that it should be quite invaluable to people.
Thank you, Gavin.
Sorry.
Is there any other reflections you would like to share at all?
Sorry, I was just trying to stop her. Yeah.
No problem.
Reflections on what? Sorry.
Well, anything at all about working with the NACEL team or various aspects of discussions that we have had in our work, or any other reflections that you've had about the patient and carer tool, or maybe everything's been said.
I was quite glad that when I was taking part in the focus groups and things, a lot of the things that I was saying from my perspective, looking after people like my dad who has Asperger's, that the neurodivergent people that were involved were saying that I was saying the things that they had wanted to say, but obviously people with autism find it difficult to articulate themselves sometimes, and I was glad that I was putting things forward that they wanted to put forward. So I'm glad that I helped other people to have their voices heard, if you like.
Thank you. If there's any questions for Gavin, please, if we could ask you just to jot them down and hold them to the end. And then what we're going to do now is hear about what people have done locally in hospitals to help transform patient and carer experience. So Rosie is going to feature the Good Practice Compendium and talk us through 3 of the case studies that are highlighted in that compendium. Rosie, are you happy to share your slides, or do you want me to try and reshare mine again?
Would you be able to share the most recent version, please?
I'm going to try and do that. It won't allow me to share the most recent version. So let me share via a different way. Thank you, whoever's done that.
Me.
Thank you.
I've got we'll go to. Okay, so we're going to talk about the Good Practice Compendium and try to get us to have a bit of a think about how we can use it for local improvement. So hopefully some of you will have had a little foray into having a look in the Good Practice Compendium, but there are lots and lots of really fascinating examples in the Good Practice Compendium. So this slide is very busy, but it's just to encourage you to know that there are several different ways in which you can search for information and have a look at the cases. So you can, for instance, specifically search for patient and public involvement, but some of the cases today we're featuring come up with different tags because we know that thread comes through many different things. And I think one of the things that's interesting about the Good Practice Compendium is that there will be specific examples that people have done that enables them to to do some really fascinating work locally, but sometimes you can read it and you can think, okay, I may not be able to do it exactly like this, but I can think about how I may be able to do a similar related project. So this is to encourage a bit of both aspects of that, really, to think about exactly what people have done, but also about how you might be able to use it locally. So we're going to just go through some quite different examples from Northumbria, Guy's and St Thomas's, and East Lancashire. And I know that there are some people, as Jess said, on the call from those different organisations, should you wish to ask them questions specifically about the project. I'm going to focus on the information that's available in the Good Practice Compendium, or the one that has been worked up as a little bit more of a case study. So Northumbria, Healthcare NHS Foundation Trust have done some work to create a home from home environment to help improve the experience for patients and families, and also to look at reminiscence work within there. And I know that Nikki, their OT, who has been instrumental in this project, is on the call. I think we're showing this because it has a slightly different flavour and shows the importance of there being many different ways to support patients and families depending on the environment that you're within and the setup that you have. So they have explained that they have purchased light projectors and storage drawers to help create some of those environmental changes through donated funds. And then as a collaborative project led by their occupational therapists with input from the wider MDT, they've done reminiscence work and other things to help support patients and their families. The resources that they've developed are available to the patients on their ward, which is around 17 people, and the evaluation has been positive. So it's just a little flavour of different ways and of supporting people. Guy's and St Thomas, or one of our other projects, they have submitted work about a range of different areas, and I think we're focusing today more on the next slides on their Let's Talk advanced care planning information, but they've also provided an update to us that the respectful awareness on the wards to help improve people's awareness that there are people who are dying and that there may be needs for those people and their families through the presence of a symbol has now been rolled out trust-wide. And then I'm just going to show some of the advanced care planning information that's available on their website. I'm very jealous of it and I think it's really excellent, and it's an example of really clear public facing information. They have it about a range of different aspects of the palliative and end of life care service, but they specifically have quite a lot of information about advanced care planning, and they've created that with involvement from a range of patients and families. And they have a range of other healthcare professionals contributing to it as well. Do you have a little look at the resources on their website? This is just an example of what some of their films look like. So they have an audio described version, a British Sign Language version, and then versions in different languages as well. And they're an interesting film showing a diverse group of people sharing their experiences of advanced care planning and really helping understand what it is in terms of what's important to them and how, as healthcare professionals, we can help make a difference to understanding that. And then East Lancashire have done lots of improvement work. I know that they have talked in their write-up about the importance of having a dedicated end-of-life and bereavement team that's separate from the specialist palliative care team, and that has been very helpful to them influencing change at a wider level. So they've reflected on that in detail, but they also talk about how they've used things to thread through their different work streams and make sure that the patient and families are central to that in all aspects of the care and the quality improvement that they are doing. And we have worked up with them a more detailed case study, which is available on the NACEL Good Practice Compendium site. There are actually 5 specific case studies that are there in much more detail that you can look at. They are really excellent examples of some improvement work that people have done with different themes. And we just wanted to showcase the presence of them, but also, for example, here, they have done lots of work locally to hear from their wider communities, including some work in the local mosques to have opportunities to hear community views, offer some education, but predominantly to hear the voices of that community and understand what's important to them, as well as the opportunity to talk about symptoms, resuscitation decisions and available support. And these have been really well received, and that there are plans in place to try and make that larger and expanded. So these examples are just very much a flavour of some of the many different cases that we have available. And depending on what you are thinking about doing locally, or if there's a particular area from the patient and carer tool that you think that you would like to focus on some more, it can be worth having a flick through the Good Practice Compendium to think about what it might be that you want to start with. And you may already be very clear with that, but we also know from our previous webinars that sometimes there's so much stuff to do and so much thinking that sometimes knowing what people have done and how they've gone about it can be really helpful to us making sure that we start something. And as we talked about with Sabrina last time, small things add up to an incremental change over time. So please do use the resource, and then equally when it comes to submitting your cases again, they are really helpful, and the more that we use them as a community, the more helpful they will be. So we are now, we're just popping the link to the evaluation here, but Jess is now going to talk us through the next steps in a bit more detail.
Thanks so much, Rosie. So just a few more steps to go through, and then we will just open for discussion. So as Rosie mentioned, the Good Practice Compendium is available with 2024 examples as well as 2025 examples. And you can filter via the submission type, be it acute or community hospital. There's various different themes that you can look at, as well as the primary driver, which refers to the 10 key areas that we focus on in NACEL. Or if there is just something you want to search for, there is a free text bar. You can put in your search word and look to see examples. The community of practice I mentioned earlier, that has about 40 members now. So we are really welcoming people to join and start discussions about anything around end-of-life care in hospitals. Perhaps there's a resource you've developed that you'd like to share, or a question that you have, or an improvement idea that you would like some feedback on. It's there as a discussion and support forum. So the next steps from today are to access the data and improvement tool, which hopefully many of you have got access to. Visit the NACEL QI pages. They have documents, tools and templates available on them. Please do sign up to the community of practice. And importantly, please make sure that a conversation is live in your hospital and plans are being discussed about upcoming NACEL patient and carer tool. There's more information on our website about what you can be looking to do, as well as resources that you can share. And we're hosting another drop-in session in July between 12:30 and 1:30, where you can come have a look at a demonstration of the tool and ask any questions you may have. The next QI webinar is on the 15th of October between 12 and 1:30, and that is around the State of the Nations report and national recommendations. And please do keep in touch with us about anything along the way.